Hello everybody, my name is Dr. Emery Pitcel. I am the owner of Rothrock Chiropractic and Rehabilitation. We are a chiropractic office here in State College, Pennsylvania. If you are a patient of ours, you have already been given, if you've had neck pain issues and whatnot, you have been given the McKenzie method, cervical spine, and thoracic spine exercise packet. On the second page under the flexion principle, there's an exercise that's called seated or standing flexion. That's the exercise we're going to show here today as a way to review for those who, if this was your prescribed exercise. So you're going to take the chair here, and while you are sitting, the first thing we want to do is make sure that you have a nice neutral spine. You don't want to be seated deep and slouched like this. Now, most people don't need flexion exercises. More of them need the extension concept, but we do find that some people need the flexion exercise. So in order to do it, we get first a nice, good elongated spine. And then what we're doing is trying to keep the upper back and the shoulders neutral. We don't want them to hunch down a bunch with, but while you keep those neutral, you're just dropping that chin and that head straight down until pain tolerance. So it's okay to kind of take that exercise into maybe a 4 out of 10 type of pain, but if you go any deeper than that into like a 5 or a 6, that's too aggressive on the exercise. But letting that chin drop down, 1, 2, holding for like a 2 count and coming back up. You could, if you are tolerating it, drop a little bit more into the flexion exercise with a little overpressure with the hand. So that way we could drop down kind of like this. Take the hand and give a little extra pull from the top of the head. 1, 2, and come back up. Notice how that whole time I'm never pulling and letting myself deep slouch in the upper back and the shoulders either. So this could be done, if this is the prescribed exercise, it could be done 5 to 6 times a day, like every 2 or 3 hours while awake. 10 to 15 reps in a set. Now, what is this exercise particularly helpful for? If we have a patient that's dealing with what we call like a cervical stenosis, so it's a really heavier degeneration of the cervical spine, sometimes that joint space and nerve space in the back of the cervical spine does better while getting pulled open into some flexion. We also find that there are severe cases of cervical radiculopathy, so symptoms that are going all the way down into the arm, maybe past the elbow down into the hand, that actually kind of need the flexion exercise to take pressure off the disc and the nerve first. And we do have some particular types of cervical strains that if the muscle is irritated just so, that flexion concept is what's going to take pressure and get blood flow and tension off of that muscle to start that healing process at home. So we hope that this exercise was a helpful review. If this was your home prescribed exercise, hopefully this helps you with your home compliance with it. If you aren't a patient of ours and you stumbled upon this video and you find this exercise helpful for your pain relief, first of all, good, we're happy that it helped. But second of all, leave a comment or a like or subscribe to the channel and continue to support us. Thank you so much, everybody, for watching. We hope that this was helpful. Take care until next time.